Hydroxychloroquine and chloroquine, Z-Pak, plasma, Remdesivir. Today we're going to talk about the most current up-to-date treatments for COVID-19. We are heading into the summer months and restrictions are starting to ease up in terms of quarantining and social distancing, but there's a good deal of concern in the medical community on whether or not there will be a rebound or influx of new infections of COVID-19 as people start to return back to their normal lives. Yes, we should return back, but if we were to get the coronavirus today, as of June 1st, when I'm writing this, what are the most up-to-date and current treatment options for COVID-19? Hey everyone, I'm Dr. Jordan Wagner. I'm a board-certified emergency medicine physician, and on my show I answer your urgent medical questions and clear up myths about certain deadly diseases. If you haven't already done so, please make sure that you hit the subscribe button and turn the bell notifications on. That way you are instantly alerted when I post a new video. In this unprecedented time, we're all grasping and hoping for medications and other treatments to help treat patients and have all of this COVID-19 madness go away. But when it comes to the safety, the science, and the efficacy, which means if the actual medications will work, for the treatment, it takes time, a lot of time. Believe me when I say doctors don't like that answer either. We want treatments and we want a cure now. But unfortunately, that isn't the case. But I will tell you this, as of the time I'm writing this, these are the current treatments that we have seen and used so far. Number one, early intubation. In other words, breathing tube and ventilator. When the pandemic first started, we were seeing patients who were very, very sick and having severe shortness of breath. Patients would present with an atypical pneumonia type picture and the oxygen levels would be much lower than other illnesses that we have seen. On top of that, the lack of proper PPE for hospital staff and the lack of understanding of the transmission of the virus early on, the standard of care was to intubate early. This would mean putting a patient to sleep and placing a breathing tube in their mouth to then be placed on a ventilator so doctors could optimize the oxygen levels and pressures inside the lung. What we found was that the patient did better if we held off intubation as long as we could and supplied oxygen to them, but allowing them to breathe on their own. Number two, treatment option for COVID, Remdesivir. Remdesivir is a broad-spectrum antiviral medication that was originally developed for treatment of hepatitis C and then was tested against Ebola virus and Marburg virus, but was ineffective for the treatment of these viral infections initially. Although it didn't work for these viruses, we've seen it work against coronaviruses. And so far, Remdesivir has been the only proven effective treatment for COVID-19. Remdesivir has gained emergency use authorization from the FDA on May 1st, 2020, based on preliminary data showing a faster recovery time of hospitalized patients with the severe disease from 14 days down to 9 days. Number three, hydroxychloroquine and chloroquine. These medications have become quite controversial due to social media, the news, and the president's alleged endorsing of it. Hydroxychloroquine and chloroquine are used as arthritis medications typically, but it can also be used to prevent malaria, which is a parasite. They have been studied for the last 40 years and the exact mechanism of how the medications work against viruses isn't exactly known. Scientists have seen that in a petri dish study, there is and was antiviral activity, meaning it would kill the virus, thus trying these medications on the coronavirus. At the beginning of the pandemic, emergency use of these medications were used to see if it would help. However, now more and more studies have been conducted, which has found that there is no current evidence in humans that these medications work. The World Health Organization had actually stopped their study on the hydroxychloroquine to make sure that the safety profile was on point, and it is now restarted, but has not seen any increased or decreased improvement or patients with COVID-19. Number four treatment for coronavirus, azithromycin. Most of you know that azithromycin is the medication that we call the Z-Pak. It is a common antibiotic used to treat bacterial infections. For years, labs have been trying to show antiviral properties of this medication, which have not fully come to fruition. Doctors have been adding this medication to the regimen of treatment for superinfections with bacteria, meaning when you get a viral infection so severe, your body is susceptible to a bacterial infection as well. This medication is not used as standard treatment for COVID-19. So the use of azithromycin is currently used for superinfection with a bacterial infection, not direct treatment for COVID-19. Number 5, convalescent plasma. The use of convalescent plasma collected from previously infected individuals to transfer passive antibodies in order to protect or treat humans dates back almost 100 years, with some evidence for benefit against rabies, hepatitis B, polio, measles, influenza, Ebola, and other pathogens. Results from small case series during the prior MERS and SARS coronavirus outbreaks documented safety and faster viral clearance following convalescent plasma administration to infected patients, particularly when given early in the disease course. So if you have coronavirus, we'd give you your plasma from somebody who had already had the coronavirus, hoping your body would make the antibodies to fight off coronavirus quicker. The vast majority of patients who recover from COVID-19 illness develop circulating neutralizing antibodies to various COVID-19 proteins 2 to 3 weeks following infection. Transfer of the plasma from these patients should neutralize virus, preventing further replication and halting ongoing tissue damage. There are risks to getting plasma as with any other blood product, but risk versus benefit is always considered, and this treatment is used only on an emergency use basis at the moment. Number 6, social distancing. We all know this, staying 6 feet away from each other. The thought behind this is due to the fact that scientists believe the virus is mostly spread via droplet, and that they say the droplets can only travel up to 6 feet roughly. This intervention has likely helped slow the spread of the virus to date. Number 7, masks in public, a very controversial topic. Obviously, healthcare workers in all settings are advised to wear masks, but if you are sick, you should be wearing one to help reduce the spread of germs to others. There is much confusion about which masks to wear and if they work. Research has shown in countries where masks are commonplace for people to wear when they are sick, the incidence of infections among others in the population has been much lower. Alright, what other medications or treatments are currently being studied? Way too many to count. Vaccines in the development right now in the United States are 22 alone. Globally, there are hundreds of medications and vaccines that are being developed and researched to treat COVID-19. And there are a few already in phase 2 clinical trials, which is promising, but it will take time still. All right, that's been your 5 minutes with the current treatments for COVID-19 with me, Dr. Wagner. Please make sure you leave me a comment below if you have any questions or if there are any other medical questions or concerns that you may have about COVID-19. And as always, make sure you subscribe and turn the bell notifications on. Thank you so much for watching, and stay healthy, my friends.